Why should hepatitis C elimination be a priority for Europe?
Viral hepatitis is a public health challenge in Europe, being responsible for approximately 55% of all liver cancer deaths and 45% of all deaths due to cirrhosis. Hepatitis infections are also recognized as cancer-preventable risk factors in Europe's Beating Cancer Plan. It is estimated that around 2.4 million Europeans are living with the preventable, treatable, deadly infectious disease called hepatitis C virus. Despite the new infection rate is decreasing over time, hepatitis C can be found in 0.5% of the population in Western, Northern, and Central Europe, while in many Eastern European countries the prevalence is estimated to be higher. People who inject drug are at the highest risk of acquiring hepatitis C as a result of sharing syringes, needles, and injecting equipments. Evidences of ongoing transmission are observed in injecting drug users, who account for 80% of new hepatitis C infections, with prevalences ranging from 15 to 70% across different European countries, 40 to 50% of them with active infection. Hepatitis C is curable in more than 98% of infected people, and for this reason, the 2030 Agenda for Sustainable Development Goal calls for specific action to combat viral hepatitis C, because the elimination of hepatitis C produces public health benefits by reducing mortality and improving health and well-being in the affected communities.
Diagnosing HCV is one of the key challenges to elimination. How do political will and infrastructure factor into this?
Chronic hepatitis C does not present symptoms for many years, and for this reason, less than one-third of people living with hepatitis C in Europe are aware of their infection, whereas most of the people are living with undiagnosed chronic infection. Scaling up testing and diagnosis needs to be addressed, because diagnosis is the entry point into care and treatment. The lack of political will due to its economic unsustainability, insufficient health and non-healthcare infrastructure, and low awareness hamper HCV screening in most of European countries. The major hurdle to achieve hepatitis elimination is the lack of finances to support hepatitis programs, and another challenge is that personal motivation for screening and cure viral hepatitis may be modest due to extraclinical factors such as health literacy and stigma, which need to be addressed properly. The ongoing success of viral elimination campaigns depend on health policies that mitigates disease in the key populations.
What can be done at the EU level to address these challenges?
Since 2016, all member states have committed themselves to the global elimination of hepatitis C. Countries are encouraged to set national targets in accordance with their local context, including awareness raising, surveillance, preventions, making testing accessible, and ensuring that all people living with chronic hepatitis C have access to care and effective treatment. Hepatitis elimination needs strong financial and political commitment, support from civil societies and pharmaceutical and medical companies. Innovative strategies, new models of care in the community, in harm reduction and addiction centers, outreach service testing and peer-supported point-of-care testing, and integration of hepatitis B, C, and HIV testing could help overcome barriers, making testing more accessible in the key populations, such as people who have used or are using drugs, those with experience in prisons, migrants, men who have sex with men, those living with HIV in specific settings. The success depends also by adequate communication strategies aiming at increasing awareness, engagement, and participation.
What are FIND and the Head Start project?
FIND is a global nonprofit working in ensuring high quality and affordable diagnostics in low and middle income countries, leveraging diagnostic innovation to bring diagnostics as close to the recipients of care as possible. In relation to hepatitis C, the main way that we did this is through the Unitaid-funded Head Start project. That's the Hepatitis Elimination Through Access to Diagnostics project. This was done in partnerships with ministries of health and implementing partners in 4 countries: India, the country of Georgia, Malaysia, and Myanmar.
What major challenges do low and middle income countries face with respect to hepatitis C diagnosis?
The major challenges that low and middle income countries face in their hepatitis elimination journey, one of the biggest ones is funding. Unlike HIV, TB, and malaria, that has the Global Fund as a global funding body to support countries, there is no such funding body for hepatitis. This means that the budget to support these programs needs to come from domestic funding. Therefore, it's critical to leverage existing infrastructure and to find ways to identify and treat people living with hepatitis C in the most cost-efficient manner.
What actions is the Head Start project taking to address these challenges?
Through the Head Start portfolio of work, we attempted to address this in 3 ways. The first is the simplified diagnostic and treatment algorithm as outlined by WHO. By using the WHO hepatitis C diagnostic and treatment algorithm, we reduced unnecessary tests. For example, in the Head Start portfolio, we had 2 RNA tests, one done to confirm viremia and the second done for test of cure. This meant that we did not do any RNA tests for on-treatment monitoring or end of treatment, because this is not in the WHO recommended algorithm, and you do not need those tests to provide high-quality hepatitis C care. A second aspect that we focused on was integration. So integrating hepatitis C services into existing health structures, such as harm reduction sites, ARV clinics, which are providing care to people living with HIV, and primary health care centers. By able to integrate the hepatitis C diagnostics and treatments into these existing sites, we were able to leverage on the healthcare workers who are already there. And by capacitating those healthcare workers to provide hepatitis C diagnostic and treatment, we didn't need to hire additional healthcare workers to come in to provide that care, nor did we need to spend the capital investments to create a siloed hepatitis program. This also has the additional benefit of allowing for more holistic care for patients. Lastly, we focused on the one-stop shop model. So this is where all hepatitis C diagnostic and treatment services are provided at that same place the recipient is going for care. So all those services are provided at the harm reduction site, at the primary care clinic, at the ARV center. This is very important because we know within hepatitis and the majority of health conditions, if somebody has to go to one place for screening, another place for diagnosis, another place for treatment, that increases the chance that you will lose that person along their care journey. This means that they won't get diagnosed, they might not get started on treatment, they might not complete treatment and get cured. By integrating all of those services into that one-stop shop, we were able to increase the likelihood that participants would follow and complete the whole care cascade, would get treated, and would get cured. And the more you're able to reduce that loss to follow-up by bringing those services all in one place, the more cost-effective your program will be.
What are the desired outcomes of this project and who benefits?
The outcomes of Head Start, the main thing that we wanted to do with this was provide evidence to Ministry of Health partners, implementing partners on the feasibility, effectiveness, and cost-effectiveness of these different models of care. So then our partners could use this evidence to inform their future scale-up of hepatitis C service provision on their path to elimination. We've had the chance to present some of these findings at EASL ILC and have several publications, and so we'd be happy for you to check those out. I'd like to thank EASL for giving me the time to share my thoughts with you, and I would like to thank you for taking the time to listen.